data requests from law enforcement, specifically ICE. But this would go for any law enforcement. So local police, county, anything like that, state police. So in the New Hampshire HMIS policy and procedure, it lays out this policy about what is required if any law enforcement does make a request for HMIS data. They would need a subpoena that is from a judge. And then once, if you get that subpoena, immediately it should come to ICA. If you feel more comfortable sending it to like Melissa or Christy, you can do that. They would still then send it to us because ICA will need to review that subpoena. We will review the request and what it's for, and we'll connect with the agency. If it's your agency, we would connect with you to ask any questions that we might have. Typically, our questions are, what is this data going to be used for? Like, what kind of investigation? All of those types of things. If we deemed it appropriate, we would release some data. Typically, this data would not be client level data, like name, because they already have all that stuff. Typically, what we've seen in a subpoena is law enforcement wanting to know if someone was at a shelter during a certain period of time. And so I can give an example of where we did this in another community. They were doing an investigation on child abuse and child endangerment. So they asked about enrollment data for a specific program. And so after reviewing the subpoena and getting some more information on what this would be used for, we were able to look up if this client even had a record and if they had any sort of enrollment in the specific program they were asking about. We would not release anything that was not being asked for. So if they had an enrollment in another type of program, we wouldn't have told them about that because they weren't asking about that program. Also, if there are questions being asked, I actually can't see the chat. I just realized that. So I apologize if I'm not answering your questions.
Megan, I'm keeping an eye on it.
Awesome, thank you. If there is any data to be released, and even if we do not release data, we would let the COC leadership know and the HMIS advisory committee. They're made aware of this request, and then also ICA's decision on what can be released, if anything. It is very important to note that ICA staff cannot provide legal advice, and no information that we provide should be construed as such, right? Like, if there's any legal questions, you will need to reach out to an attorney for that. But when it comes to a subpoena, definitely send it to us. You can also have your own legal counsel look at that. ICA does direct all questions. Oh, yes. Echoing, sorry. We do direct all of these types of questions of legal nature to our agency's legal counsel, so we do have access to legal counsel to ask these questions. I also want to let everyone know that we are looking into the policy we already have to see what we might be able to strengthen in the verbiage. I have spoken and consulted with the executive director of the Vermont Asylum Assistant Project, and they were very helpful. So I will be crafting some verbiage with the help of that executive director. They work very closely. They were in Washington last week, and they work very closely with our representatives and have their hand on the pulse of everything. So they're it was very helpful to talk with them. We just want to make sure that we are doing our best to protect the data of the clients that you all serve. All right. Then there's going to be data requests from non-law enforcement. So this is like the mayor or the governor, or maybe there's a college, university professor, or the state in, I put the state because we may be using this for for another uh, implementation, but usually the state requests come through Melissa or Christy or one of the BHS staff. So it's slightly different for that. But say if your governor or a mayor is asking for requests, those requests would come to ICA, and then we would go to the COC leadership for some approval of like what we can release. These requests are only aggregated data. We do not send client level data out, especially if they are not COC agencies. So like the governor's office might be asking for the number of folks in the shelter during a specific period of time. We're only literally going to give them the number. We are not going to say, here's the list of people. We will not do that. So we also, if there's more than, like if there's a lot of things they're looking for, which has been happening quite recently, a lot recently, we work with that entity first to understand what they're requesting. We need to provide context, verbiage, we provide edits to the verbiage that they think that they want to use, because we want to make sure the data is being represented appropriately. There has been times when data has been taken off of our website and then people don't understand what that data is actually saying or where it's pulling from, and there's just misunderstanding of it and it's not represented correctly. So if there's any data requests coming from anywhere, it's a good idea to reach out to ICA to make sure, specifically HMIS data, I should say, to make sure that one, they're getting what they want, and two, once they do get what they want or need, they're understanding what it is and that it's being used appropriately. It's usually one of our questions. What do you need this for? What is it being used for? It's usually my first question. All right, any questions for those two things?
I don't
All
see any
right.
questions yet, Megan, and no one has their hand raised.
Awesome. Thank you, Christy.
Yep.
All right. So some data sharing is a little bit different than data requests. So there's kind of two types of data sharing, right? There's inside the HMIS, and then there's data sharing that happens outside the HMIS. So within the HMIS, the data sharing only happens with those agencies that enter data into the homeless management information system. Each agency signs an HMIS partnership agreement. I'm going to call it the agency partnership agreement because there's also the coordinated entry partnership agreement, but that's different. And this is an annual document. It is where the agencies agree to follow the policy and procedure and make sure that they're upholding all of those policies. We do have a list of all the agencies that do currently enter, as well as those that used to enter and may not have any programs that they enter anymore, as well. And also I think there is some confusion with some agencies about what you need to ask clients about sharing. So you only need permission to share data inside the HMIS for each client. That's where the HMIS part of the ROI comes in. into play. You don't need permission to enter the data into HMIS. If you're all required, if you're an HMIS agency, to have the consumer notice available, hanging up wherever clients might be located. You can have it in your office available. But when they consent to services, they're consenting to having their data collected and entered into this required database. And even if you don't have federal funding or state funding and you enter into HMIS, you are still required to have that consumer notice and follow the same policy around the data entry and permission to share data. Are there any data sharing within HMIS? The policy and procedure manuals is where all the COCs and agencies have agreed to do open data sharing within the HMIS as well. Just in case someone is wondering where the permission for open data or shared data comes from. All right. So sharing data outside of HMIS. So right now, sharing data outside of HMIS, there's probably more ways to do this that I'm not putting in here, but a really big thing that a lot of the HMIS agencies are doing is coordinated entry. So there's the coordinated entry partnership, and this is very specific to obviously coordinated entry and who can be involved in talking about clients that are on the coordinated entry prioritization list. The HMIS data that contains client level data can't be shared with non-HMIS partner agencies. So if you were to pull that list and they're not somehow, there's no ROI signed, they're not on the coordinated entry partnership agreement, they should not be looking at that coordinated entry prioritization list, because I believe that there is names on the New Hampshire one as well. Only aggregated data can be shared. So again, this is like if you need to send something to a board member, you can send aggregated data to your board member for your specific programs. That's totally fine. A lot of agencies do that. And you may even be required to have a report for them. Again, if there is something you can't pull because you need a custom report for that, you can let us know. And we're happy to help with any kind of data requests from your board or from your community, anything like that for your specific programs. Again, outside of HMIS, there's other kinds of policies that govern that. ICA isn't necessarily involved in some of the data exchanges that happen. So like if you have a client at a mental health agency and usually mental health agencies have their own type of release of information. So if they needed to tell an agency like for PSH that here's their diagnosis, that is different than HMIS. That's like medical information. So you would need the ROI that the agencies use for that type of exchange. That wouldn't come from the HMIS ROI. Questions?
Megan, I'm not seeing anything, and I just wanted to let everyone know that the New Hampshire Coordinated Entry Partnership Agreement recently went out for all agencies to re-sign. This is at an agency-wide level, and they are due back to BHS on the 11th of April.
Also, if you have any questions, you can reach out to the help desk. And if we can't answer it, or if it's maybe something that like is a two-part answer, like maybe there's an HMIS part to it and a non-HMIS, we can help with the HMIS and then help you figure out where to go for the non-HMIS part. We do that all the time. Oh, okay. Looks like Eddie has a question.
Hi, good morning. Quick question. I resent the HMIS release back. Do I need one for every single one of my case managers as well?
So
The
Eddie, are you talking?
HMIS. Sorry,
It's
Chrissy, you
okay.
go.
Eddie, are you talking about the coordinated entry partnership agreement, or are you talking about HMIS?
I think it was the coordinated entry partnership agreement. Oh, no, that was the HMIS. I'm sorry.
So there's the ROI it covers anyone who is entering into the HMIS. I think I'm answering your question. There's an HMIS user agreement, which everyone signs when they take the new user training and then annually for the security training. And then each agency, so the executive director or your CEO or whoever is in charge of the agency or signs the HMIS agency partnership agreement or agency partnership agreement.
Yes.
The release of information is the client signing it for for the agency to release the to share the data in HMIS.
Okay.
Good. I'm glad I was able to answer that. Okay.
And Eddie, just for clarification purposes, I have not seen that your agency sent the New Hampshire Coordinated Entry Partnership Agreement back as of yet either.
Really?
Yes.
Okay. Is there any way you could send me those documents? Because I thought I sent something to earlier
Let me double check.
last week.
Okay, let me double check.
All right. Chrissy, do you want me to move on to the system performance measures?
Yes, please.
Okay, I am trying to think of what the best way to do this. Because there's two ways of showing this. Do you want to see the comparison between FY23 and FY24? That is actually what I sent to Melissa. So
yes,
let
please.
me try and get this. Okay, I'm gonna try and get this so it is, you can see it. It's very, all right. So the system performance measures were delayed this year. We have been able to submit them to HUD. Nationally, they are due April 11th, and then, but we've already submitted, so we're good to go for the balance of state. The system performance measures are a group of 7 measures. However, we only submit for 6 of them at this point. Measure 6 is a prevention measure, and no one in the country submits data for that yet. And not sure if we ever will. The date range for this is October to September. That is a federal fiscal year. And the one we just submitted was October 1 of 23 to September 30th of 24. So feels like we're like a year behind, but that was the last full fiscal year that just happened. All right, so measure 1, length of time persons remain homeless. This measures the number of clients active in the reporting date range across emergency shelter and safe haven. So that is the first measure right here in line 1. So if you see ES, EE, and ESNBN, those are just different and like how emergency shelters enter their data. So that's emergency shelter entry exit. That usually is a year-round shelter because they have longer stays. And then emergency shelter night by night. Typically that is seasonal winter shelters because they don't have as long of a stay. And in the balance of the state, we don't have any safe havens. There may be programs called safe haven, but there are no project types with safe haven. And then underneath that, you'll see that there is emergency shelter, safe haven, and then they add transitional housing. So this is along with their average and median length of time homeless. This includes time homeless during the report date range as well as prior to the report start date, going back no further than the look back stop date or client's date of birth. So whatever is later. I can try and get actually better verbiage on that. The reporting team is really good at that. And Shartina actually is really good at explaining these as well. She's had to do a lot of system performance measure presentations. You'll notice that there's 2 different types of measures in measure 1. There's 1A and 1B. 1A really is looking at the entry exit and the bed night dates that are entered into the HMIS. So there's nothing like extra added into this. It's strictly just those enrollments. And for night by nights, it's looking at the bed nights that are between the start and close date. Then in measure B, you'll also notice that they've added permanent housing to this. It includes data from each client's living situation response, as well as time spent in permanent housing between their start date and their housing move-in date, which typically rapid rehousing and permanent supportive housing is what is considered PH. Those are the 2 different types that are included in this. So those 2 programs, the start date is when someone is deemed eligible and they are typically literally homeless. So they might be unsheltered or they might be in an emergency shelter. And then once they are physically housed, a housing move-in date is placed in, and that is where their homelessness ends and where the calculation for this would end. So I think 1B, everyone, is probably saying that is what you've been very average lengths of time of people experiencing homelessness. I mean, the same thing in 1A, because it's been difficult to find housing that is affordable. It's usually the main reason we can't place people. And previous FY is the 22 to 23 data that we submitted last year, and current FY is that 23 to 24 data, just in case you, just to confirm that. Measure 2 is returns to homelessness for persons who exited to permanent housing destinations. So this measure looks at clients who exited street outreach, which is the SO, emergency shelter, transitional housing, safe haven, or permanent housing to a permanent housing destination in the date range 2 years prior to the reporting date range that we're currently looking into. Of those clients, the measure reports on how many of them return to homelessness, as indicated in the HMIS, for up to 2 years after their initial exit. So each category is going to have their own line. Street outreach has a slightly different definition of positive exits, but I believe that's using the same exits that the rest are in this one. We'd have to check on that. That I don't actually remember. But the first section is going to be the current fiscal year that we just submitted, and this one over here, I'm going to try and make it so you can see it, but that means I have to make it smaller. I'm sorry. Is the previous year. Trying to make it so you can see. It won't let me do it. So it looks at the total number of persons who exited to a permanent housing destination, and then you'll see each of these are looking at when someone might have returned to homelessness after they exited. It looks like the first two, so less than 6 months, and then 6 months to 12 months are either the same or the percentage is just slightly increased. The return to homelessness for 13 to 24 months, though, has increased, and so has the percentage of returns in 2 years. That is an increase for the current year from the last year. That might be something that the COC wants to look at, see what might be happening there. So number of persons experiencing homelessness, what this looks at is change in point in time counts for 3-1, and then a change in annual counts. This measure for the 3.2, the change in annual counts of sheltered homeless persons in HMIS. So it looks like there was a decrease in those in the annual count for those who went into shelter, and then it looks like there's a slight increase in transitional housing. This could be because maybe some beds closed. This could be there's not a lot of movement, and so we're not a lot of people are going into shelter because there's not a lot of movement out of shelter. There could be a couple of reasons why this is happening. Does anyone have any questions so far? And if I don't have an answer, we can research it for you. All right, measure 4. Measure 4 is an employment and income growth. This is only looking at COC funded programs. So rapid rehousing, permanent supportive housing is typically what this is looking at. It's divided into 6 tables, capturing employment and non-employment income changes for system leavers and stayers. The project types reported in this metric are the same for each metric, but the type of income and universe of clients differs. And again, that's only limited to COC projects. So the first 4-1 is looking at earned income for adult stayers during the reporting period. That's 4.2 is non-cash, non-employment cash income for adult stayers in the system. And then change in total income for adult stayers during the reporting period. So those first three are for those that have not exited during the reporting period. And then the next three are for those that have an exit during the reporting period. Again, if there are questions about, exactly what programs are being pulled into this, we can get that as well.
I also just want to add that after Megan's presentation, I will be going into how system performance measures tie into all of the continuum of care projects.
Yes. All right, I'll make this bigger now that we don't have any more graphs. So measure 5, number of persons who become homeless for the first time. So this measures the number of people entering the homeless system through emergency shelter, safe haven, or transitional housing in 5.1, and then in 5.2 it adds adds the 2 permanent housing projects. Determines whether they have any prior enrollments over the past 2 years. So again, this doesn't go back further than 2 years prior to the reporting period. So if they had an enrollment in shelter in 2020, that's not going to be looked at in this report. If we wanted to look deeper into first-time homeless, we can. However, if we are going to use this as a measure, we do typically say you should use what you're submitting to HUD, because it does have an effect on the NOFO. Those with no prior enrollments are considered to be experiencing homelessness for the first time. Which just wouldn't let me, oh good, it is gonna let me do it. Sort of. So you'll have your persons with, the universe is looking at the persons with entries into your emergency shelter, safe haven, or transitional housing. And then this is going to be of that universe, those that do have an enrollment in these project types within 24 months prior to their starting during the reporting year. And then these are those that do not have entries. So would be considered new. And then same thing down here. You'll see we skip number 6, not even in the report, and we go down to measure 7, successful placement from street outreach and successful placement in or retention of permanent housing. This measures positive movement out of the homeless system, and it's divided into the 3 tables you'll see. Movement off the streets from street outreach, which is 7A1, movement into permanent housing situations from emergency shelter, safe haven, transitional housing, and rapid rehousing, which is 7B1, and then retention or exits to permanent housing situations from permanent housing, which is anything that is not rapid rehousing. So PSH would be in here. Street outreach has a pretty successful rate for street outreach, which is which is great. Typically with street outreach, I believe emergency shelter is considered a successful placement. So they're going from being on the street and the elements to being into a place with a roof and some running water and heat. And then we have exits to permanent destinations from rapid rehousing, street out, emergency shelter, and safe haven, and transitional housing. A little bit not as great. But again, I think this speaks to like measure one, where it's just very hard to get people into housing. However, it looks like your retention rate down here, from things like permanent supportive housing is actually pretty good or very good. It increased this year. So I would say that I see this as a positive strength of your permanent supportive housing programs. Are there any questions? Sorry.
I am not seeing any, Megan.
Okay, thanks. Hopefully no one fell asleep, sorry.
I'm just excited about the retention of permanent housing. And so I just want to say thank you to all of our COC and YHCP projects, because that is amazing.
It is. It's a very difficult, right? Once you finally get someone housed, then you are keeping them in housing. So it's very exciting. That's hard. They also have a data quality section. But that is not factored into any of the NOFO stuff, I don't believe. The measures definitely are though. So what usually happens every year, or we try to do this every year with the COC leadership and the collaborative applicant, is we walk through these and then we see like what we try to look at the scoring that they do and see, will you get more points for these or will you not get more points for these? You know, what might some sort of planning look like, or give, they get ideas of what we can look at for data to help with that planning as well. So these are definitely used. It's not just sending HUD some data.
And I think most of the COC projects know from the last couple of years is that when I have been sending monitoring reports out as of late, everyone is getting a very small snapshot of looking at your system performance measures, which is measure 4, whether you're increasing income, non-employment income, increasing connections to mainstream resources. I also give you a snapshot of whether or not you're exiting people to permanent housing destinations, how many people you're serving. So that information is all included in every single monitoring report that is sent out from VHS. It's also included when we look at your annual performance reports every single year, as we are looking at all of those measures as well within your own projects. And each project's performance affects how the balance of state is performing. So HUD I look at it as wearing different hats. HUD is looking at how each project is performing, but also how our continuum of care is performing as well in regards to system performance measures.
Yeah, and the system performance measures include all types of funding sources. So measure 4 is really the only one that is strictly for COC funding. All the rest look at anything that any of the data that's entered into HMIS. So if you have an emergency shelter that is privately funded and you enter into the HMIS, that gets factored into this data as well because you're part of the system. You know, you're not siloed out.
Yes, Angie.
There's
Just have a quick question about the performance measure for somebody who goes from street homelessness into a shelter. They're there for one night. Is that still considered a positive performance measure? Because say the next night they decide to come back to our attachment that does not have any shelters. Does that turn into a negative for us, or would that consider to stay a positive even though they only stayed one night in a shelter?
well, for the street outreach, it only looks at that street outreach exit. It doesn't look at then what happened after the exit for the street outreach program.
Thank you.
So Megan, what I think you're saying is it would be two different entries. Like they entered
Right.
into street outreach, exited to shelter, and then they entered back into street outreach.
Right. And then it would just say that you now have there's a client that just entered into permanent or entered it back into your program. It's not going to I'd have to see like what specific enrollments it looks at, but yeah, like if you have an exit to shelter, it's not going to say, well, yes, they entered shelter, but they were only there for one night and then they came back. That's not how the report would look at it.
So I wouldn't look at it as a negative measure. It's just looking at the now and that day measure in a sense.
Yes, and I can take that to the reporting team and ask them a little more about that. But yeah, it's not programmed or that intuitive to say like, okay, it's only a positive if they don't come back to street outreach for like, say, an exit to permanent housing, right? Like
Right.
it's not looking at that they only stayed at shelter for one night for your street outreach program because they're not like related in the enrollments.
Right. Okay.
And in reality, that happens, right? A lot of times there's not much you can do about it.
Does anyone have any other questions for Miss Megan or ICA or me?
So does that kind of work the same way for shelter? Like, I mean, we get not a ton, but we get people that, like, for instance, move from our shelter to another shelter. Why? I don't know. Why is another shelter accepting people that are already in shelter? I don't know. But or somebody who leaves and the situation didn't work out. Obviously, we can't tell them, no, you can't leave, but they'll leave, even against our advice, and then come back. Is that a ding?
So it's not specifically looking at just your agency, and I don't think so. I mean, it's not, if the exit is not to permanent housing, it's not being counted in the numbers for those going to permanent housing or those returning to emergency shelter, right? Because they weren't permanently housed.
Okay.
So if they went.
Yeah, sorry, man. Yeah, to piggyback on that. So shelter to shelter movement is not included in any in system performance measures.
Yeah.
Adam, this is Melissa and Megan. I had a question kind of related to this. So what Susan's describing really seems like a day-to-day kind of thing, and the system performance measures really capture more of like that big picture, right? So it's not going to necessarily pick up on day-to-day fluctuations. It's looking at like the year overall. This is what our entire system did. Is that accurate?
Yeah.
In a sense, yes. Yeah. The system as a whole is what is measured. But if you take your entirety of your program population, it will then filter down to a smaller group of folks within that program to see how their movement goes from, say, in this case, shelter to housing status. Um, it, it really does narrow down for a lot of the measures who you're looking at. And so if you really wanted to see how your the APR, the CAPER, I think is a better way to look at your program level data in terms of your performance there. System level data is really, to Melissa's point, how is your system doing on the whole? It's a 30,000 foot view of how your community is doing. There are some, and I have very strong opinions about system performance measures. I have strong opinions about everything, but I digress. One of the things that hasn't happened with HUD is that they haven't actually reviewed how they measure system performance since they created these more than a decade ago. And some of them really are kind of overdue for a tweak and a revision. And what they're looking at isn't necessarily super helpful for us. And the other part of the challenge is that the other complaint I have about them is that a lot of the measures we have really deal with external forces on your community that are beyond the control of the COC and the agencies within the COC to manage what happens. And so that's why I go back to, if you want to see how well your project is doing in addressing services of the people standing in front of you, CAPER, APR, custom reporting is a better way to do that. So we try to pull out as much of the nuggets of beneficial information from system performance with a very strong caveat that there are things that, first-time homeless folks, unless you have a limited number of dollars for prevention and the ability to get landlords to agree to, work with your clientele, a lot of first-time homelessness is out of your control. Just it's market forces that demand that impact that. So yeah, it's one piece of the puzzle and not the entire puzzle itself.
And that's reassuring because the CAPER is what we use when we look at our shelters and when we are talking about data with them. So, and then Susan, I think it's important to also note, and Christy, I think we'll talk a little bit about this when she talks about the next thing that I always call the wrong name. So I'm not even going to try. Nobody's getting dinged because of individual client circumstances. We can offer supports, we can offer services, but sometimes things happen that again are out of our control. And really it's more about like the effort, your policies, your practices, are you doing best practices? And then to Adam's point, and I think Christy will talk about this as well, there's a reason that projects aren't automatically involuntarily reallocated because they're below threshold. And it's because of what Adam just said. Like, we know that we're in an affordable housing crisis. We know that people are staying in shelters longer because there's nowhere to go. All of those different things are impacting numbers as well. So, if you are receiving a corrective action plan because you're below a threshold, it's not an automatic reallocation. It's like, let's talk about this, and a lot of those things will be out of your control. So that's just my 2 cents on that as well. And I'll turn it back to Christy. And hi, everyone. I was late. Sorry.
Thank you, Melissa.
Does anyone have any more ICA related HMIS questions before I kind of diverge off into system performance and COC projects? Megan was blinking, but I don't think she has a question. All right, so let me share my screen. So I am going to specifically talk about the Balanced Estate Continuum of Care's performance monitoring process. This only applies currently to Continuum of Care permanent housing projects. very clear, it does not apply to shelter. It does not apply to YHDP projects, and it does not apply to any of the coordinated entry or supportive services only projects that are funded. It is only in reference to permanent housing projects as of right now. So two things which I want to be very clear about. So I know I feel like a lot of you think we monitor too much. The Balance of State Continuum of Care is required to monitor all of the projects within its continuum of care that are relevant, in which I just said, on an annual basis. So all of you COC permanent housing projects. The Bureau of Homeless Services is required as a recipient of grants to also annually monitor your projects, which is when I show up on your doorstep and do your program financial review and your participant file reviews. Today, I'm going to be talking about the Balance of State's performance monitoring reports. This is included in the Balance of State reallocation policy that we monitor each of the COC projects annually based on their performance. Typically, these reports come out in March or April. They are going to be coming out very shortly this week. These details of any of these reports are made public, and what we look at per the reallocation policy of the Balance of State is we are looking at those system performance measures. So specifically, we look at, for scoring for performance monitoring, we look at increased participant earned income, increased project participants' unearned income, the increased number of participants obtaining non-cash mainstream resources. Those are the four big ones in Measure 4 from system performance measures. We also look at, for performance monitoring, is we look at what percentage of the grant was expended for the last full operating year. We look at data quality. So we're specifically looking at the percentage of HMIS client records that have null or missing values. We look at the timeliness of you submitting your information into HMIS or a comparable database, which is within 5 days per the HMIS policy. And then lastly, we're looking at the timeliness of your annual performance report submission to the Bureau of Housing Support. I said the wrong name. You'd think I would know it now. It's the Bureau of Homeless Services. So we look at those specific measures for each one of the continuum care permanent housing projects. And this information specifically comes from your NOFO scoring from last year. So we look at all of that, and we look at the total performance score for all of those questions. So for this year, the total score that a project could receive was 35 points. The Balance of State last year voted, not last year, a couple of years ago, voted that we would take the median score, and anyone who scored at the median score or below would receive a corrective action plan. So looking at this, we send out a corrective action plan every single year, a monitoring report for each project to submit a corrective action plan back to the Balance of State to review. We are looking for projects to say, yes, we are going to connect people with Workforce Ready, or help them connect to employment, or help connect them to Social Security. How are you going to improve those measures for your project in order to serve your participants better, in order to maintain and sustain their permanent housing? We specifically look for those corrective action plans, and those corrective action plans are brought to the executive committee to review. I can tell you we have been doing performance monitoring reports on all of the COC projects since 2017. So far, we have not involuntarily reallocated any of the projects. And this is because of a really strong partnership that I think we have with all of the COC projects, where we're able to work with all of you to connect, to provide that technical assistance and support, to work on increasing those measures, taking a look at why are any of those measures low? How can we improve them? I mean, one of the simplest ones that we look at is whether or not you're submitting your annual performance report on time. So how can we help you make sure you're submitting that to BHS on time? So we really look to provide that technical assistance and support so that all of your projects can improve your scores. We have high performing projects within our continuum of care that are supporting our system performance measures, helping our NOFO scores so that we can get new projects and new funding into our community. So once we do issue those monitoring reports, again, your agency send back corrective action plans for anyone who is at the median score or lower. The executive committee looks at a variety of things, including any monitoring findings that are outstanding or overdue, any history of inadequate financial practices, how many times your program has been cited in the past, what steps that project has taken to improve their performance measures, anyone who has a history of serving ineligible participants. And all of this information can be found in the reallocation policy that the balanced state voted on. So what we do is I bring all of this information to the executive committee. We review all of the reports and talk about any recommendations moving forward for the next year, and whether or not we need to start speaking with an agency about the involuntary reallocation process or even the voluntary reallocation process. We've worked with projects in the past where they have voluntarily reallocated some of their funding because they're not fully expending it, or looking at the project as a whole because it is not working as it was initially intended to be designed and implemented, because we all know times change. Project may have been designed 20 years ago and it is just not feasible and working in the current environment that we have. So I'm going to pause there because I know people always have a ton of questions about this process. And I want to say it's not, we're working to make sure that all of our projects within the COC are performing the best that they can. And we're not looking to come in and just take people's money away, but to help support our continuum of care so that we're serving our participants in our program to the best of our ability. Let's see if there's any questions. And my chat is being funky. I don't see anything. So what I will do is I will share the reallocation policy, which includes both voluntary and involuntary reallocation process for all of you. For any of the projects that did score at the median or below, you will see a monitoring report in the next couple of weeks, probably by the end of this week. If you have any questions, please feel free to reach out to me directly. But again, it really ties in what Megan talked about with those system performance measures. We look at your system performance measures for all of your COC projects through the balance of state performance monitoring, at your on-site monitorings every year, and with your annual performance reports, and when we do NOFO scoring. So we continually look at these measures throughout the year for all of the COC projects, and try to figure out ways that we can help and support all of our projects and improving them and improving our overall COC and our response to homelessness. I'm really surprised no one has questions. Maybe I've talked about this enough.
You were very good in describing the process.
Thanks, Susan. All right, well, if you have questions separately, I think most of you have my email. So shoot me an email and I will send it back over, I believe, to Melissa, and I will be talking again, but mainly Melissa, if she's ready.
I don't have the agenda up, so I was just hoping you would point to me when it was time.
Hold on.
No, it's okay, Bert. My plan had been to do just sort of a what we know right now about our HUD funding. As I'm sure you all are aware, it's been a roller coaster for for a few months now. So for I'm going to speak specifically about our Continuum of Care projects right now. So if you're not funded through the HUD Continuum of Care, this is just information, but it's not necessarily relevant to you. We're currently operating under our federal fiscal year 23 awards. So I think our first grant that ends for that cycle is coming up at the end of May. So starting at the end of May, we'll start to see our grants from FY23 end. We have been told by our HUD field office that our FY24 awards, so the ones we applied for last year that we received notice about, I think it was very early January or like right before the inauguration, we got those announcements. So we have been told that those are being processed. We have not received them yet. It's not all that unusual for us to not have received our grant agreements yet. So I think last year we started getting them May, June, July. Sometimes we got them after the grant had already started. So I would say right now we are not in a position for the coming year where I'm nervous that we won't get the funding. What I am sort of waiting on is the actual grant agreements. So a couple of other COCs across the country, it could have been more than a couple, but COCs across the country did start receiving grant agreements a few weeks ago that had some new language in them. Some of the language was extraordinarily vague and unclear about like, what did it mean? So I don't have it in front of me, but one of the things was about not using the funding to support any DEI activities, but without an explanation of what that actually meant. And I feel like that is something that could be interpreted differently by different people. So I did send a sample to our legal team to review, but before they even got it, HUD had rescinded those grant agreements. What we're hearing is that the grant agreements that are going out now have language about how we cannot violate any federal anti-discrimination laws, which cool, we couldn't before, so that's fine. So what we're hearing is HUD is issuing grant agreements for grants that started in January and then kind of working their way up. So again, our first grant starts in June. We are not quite concerned. We're really not concerned yet because it's, it's still early April. So FY24, we should be in fairly decent shape. We didn't receive any new projects in this award, but every single renewal project did see a bump in their supportive services funding. Chrissy, is that right? Was that the line we think? It was like a cost of living increase that HUD gave for the first time. So every single award will see that their dollar amount has gone up.
Melissa, I'm going to interrupt you for a hot second.
Sure.
Once we actually receive the grant agreements, I will be reaching out to all of the projects to further develop your budgets with the supportive services increase.
Yeah, we saw the total dollar amounts, but we haven't seen the breakdown from HUD about what's in what line item. So we're just waiting for those things. And once we have them, like Chrissy said, we'll work on that with you. I was going to say one pager, but it's 2 pages. So I will drop this in the chat. The National Alliance to End Homelessness released a summary, and I'm throwing it in there. It's a summary of what was included in the continuing resolution for the FY25 budget and how it impacts HUD homeless assistance grants. So kind of skimming through it, the Emergency Solutions Grant, which some of you may also have projects funded through that, seems to have been level funded. There's funding in there for the Youth Homelessness Demonstration Program, and then the Continuum of Care projects. I'm scrolling down. It's hard for me to explain it in a way that's logical because my brain doesn't work this way. So ultimately what it works out to be, and you can see it under the implications, is that there is sort of a gap in funding for continuum of care projects. It was funded at a lower amount than previous years. The continuing resolution gives HUD the ability to repurpose funding to cover the renewal demands, but it still leaves a shortfall. So we don't know how that will impact New Hampshire or any other COC at this point. We do know that, and they've funded quite a bit, but it does look like there is the potential somewhere in the country for there to be a shortfall in funding. So we'll be paying attention to that. You can look at the thing I just dropped in the chat. We're waiting to see what information we get from HUD about this, and as soon as we know anything, we'll let you know. The timing is just sort of odd because last year was the first time we had that 2-year NOFO, so we're not supposed to have a NOFO this year. But there's this sort of strange funding predicament that they're in. So we don't know how that's going to play out. I'm not sure they know how it's going to play out yet either. But for now, my focus is on getting the FY24 awards and getting all of that sort of out to all of you. Every single one of you that has a COC contract with us will have to do a grant amendment to align the funding with the increase that we got this year. So stay tuned for that. Hopefully we get that information sooner than later so we can start that process. But like I said, as soon as we know, we'll let you know. Trying to think if there's anything else. Christy, what does the agenda say that I'm talking about? Is that it?
Yes, that was it.
Okay. Any questions on that? And while I have the floor, I'm just going to put in state budget wise. We are on step 3 of step 5. So we still have a ways to go. At this time, what the New Hampshire House is voting on or has voted on, or I think they're voting this week, I don't even know. The funding for the emergency shelter system and the housing stabilization programs remains intact in the House budget that is going forward right now. So that hasn't changed. That's the same as what was in the governor's budget and the same as what was in the agency budget. That includes the prioritized needs request that we had for the shelter funding. So for anyone who has an emergency shelter contract with us, you know that right now you have 2 contracts actually. One is the regular emergency shelter one is the bed rate contract. The way the budget is moving forward at the House, those 2 things will be combined and it'll be 1 contract instead of 2. Hopefully that will be easier for all involved. If the budget does go forward as it is today, all emergency shelters will have to have a contract amendment to align the funding with what gets approved through the budget process. So stay tuned. That is also constantly moving and changing. It goes to the Senate next, and then from the Senate, it goes to like a joint committee, joint House and Senate. I don't remember what it's called. And then from there, if they agree on a budget, it goes to the governor for signature. So I feel like that's a relatively positive thing considering everything else that's been in the news lately about the state budget. So I'll pause. Any questions about that? No? Okay, that's all I've got. All right, Christy, what's next? I'm turning it back over to you because I don't have my agenda.
Open floor. So if anyone has anything they want to bring up or any questions.
How are pit numbers looking this year?
Megan, are you still here?
Yes, we're in the middle of still data cleanup for the non-HMIS. Travis sent over all of the things that we reviewed, and we're still going through that. So that's what they look like. Our goal is the end of this month, beginning of May. They're not going to be, we don't have a due date for them. What typically happens with the federal reporting is after the LSA is submitted, that's when the system performance measures usually have their time. After that's submitted and the due date ends, that's when they will let us know more about the submission and when HDX will open for us to even be able to put data in there. We haven't heard anything about the point in time and housing inventory chart. We probably won't maybe we'll hear tomorrow, not tomorrow, maybe we'll hear by the end of this month. Because the system performance measures closes on the 11th, and then we have a HUD call the middle of this month. I have to look at the calendar. And maybe they'll tell us. Our goal is the end of this month to have at least draft data compiled.
Thank you, Megan. Brenda?
You're welcome.
This may have been discussed before I came in a few minutes late, but I wanted to see if there's any direction around language, images, anything from regarding marketing or website content that we are being directed to adhere to. I just want to be ahead of the curve if there is.
I would say that's the kind of thing that you should probably consult with like your agency's legal team with. Since we don't have new grant agreements yet from HUD, we don't know what changes they're proposing. I've seen the different drafts floating around, but they do keep changing. And I don't want to make assumptions based on things that I'm seeing. So we have made the decision to wait until we have actual formal guidance from HUD before we suggest any changes.
Is there any concern that any of us as partners, and this is just kind of what keeps me up at night, why I'm asking the question, that because we collectively work together, if there are partners who have things that are not allowed, I'm just going to use language, images, whatever, that may not be allowed or perceived, I would not want to impact our funding for the state. So that's really why I'm asking for the direction. It's kind of like COVID all over again. I feel like I'm in this, like, what do I do?
Yeah, no, I completely understand that. So I think the best way to answer that is to remember that the state of New Hampshire is actually the recipient for every single grant. So HUD will be looking to the state of New Hampshire first. And typically they don't look to the subrecipients. I say typically because who knows, they could change their guidance. But typically the recipient is the one responsible for whatever they're looking for. And sort of what we're hearing through the grapevine is that states tend to be more in compliance because they're more governmental. Like all of our language is pretty scripted. So that's why I'm not super concerned yet. The new grant agreements or drafts I've seen do have language about subrecipients can't do this or that, but we don't have those yet. So we're still operating under old grant agreements that don't have some of the new things that have been talked about in them.
Melissa also looked at the Balance of State governance charter as well against some of that new language that we had seen in the grant agreements and was rescinded, just to double check our own governance charter for the continuum of care. And we did a really good job, I will say, writing it a couple of years ago. It's very straightforward, and I think it's okay. We both do. So Melissa and I are both keeping an eye on all of that information, both from the continuum of care perspective and as the recipient of the grants. And we'll keep you updated once we know anything. And I was really looking forward to my summer off from NOFO, but we'll see what happens.
You better find some wood to knock on like immediately.
I live in a wood house. For
There you
those
go.
of you who don't know that, I live in a Lincoln log house, so I'm good.
I can see that behind you.
Does anyone have anything else?
Something that's just related, it's Freeman. Related to the home ARP leads, we're definitely reaching out to the people we were told to reach out to, but I'm just noticing that, you know, with these home ARP leads, some of them are kind of prohibitive to the group of people that we're serving, in the sense that, you know, one of the leads we tried to pursue was had $100 per person application fee for adult household members and a $500 apartment holding fee. Are we, you know, able to utilize? I know obviously if someone's enrolled in my permanent supportive housing program, that there are some funds that can help deal with some of those things, but when someone isn't and we're trying to make a referral, it's been making it a challenge. Is there anything you know, that we're doing to try and work out arrangements with these other parties that are participating in these home ARP openings to kind of mitigate that, because it seems problematic?
Freeman, I didn't know anything about those issues. Can you send me an email so I can bring it to my next meeting with New Hampshire Housing about it?
Oh yeah, it'd be my pleasure. And then like my part two of that question is like, we've got home ARP, we've got stability vouchers, we've got, you know, this kind of voucher, that kind of voucher. They're all just Section 8 vouchers. Is there any feedback being given to like HUD or anybody that cares to say, hey, you know, we're all intelligent service providers. Give us a group of vouchers. Tell us how many of them need to go to unsheltered, and tell us how many of them need to go to people that are in PSH programs. But like, I've got a log jam in my PSH program where the amount of money I'm provided with every year is not enough money to serve the amount of people that we're supposed to serve. And even if that weren't the case, I know that a lot of my peers are in the same position where, without a guarantee of a voucher to give to those people that don't need to be, like, we're never going to make room in these supportive housing programs. So I know, like, you know, between moving on, home ARP, stability vouchers, it gets confusing. Is there any way we can work as a group towards merging these into, hey, here's a pile of vouchers. You need to use 5 of them this way and 5 of them that way, and simplify this, because it's getting confusing.
That's a HUD issue that we are not going to resolve easily.
Understood. All right.
Yeah.
I'll discontinue complaining.
And Kayla, I see your comment as well. So if somebody can send me, like, Kayla, if you can email me as well, and Freeman, that way I can say I've heard from more than one that this is an issue. I will bring it to my next meeting with them, which I think is on Monday. So. All right. Anything else? I hope you're all hanging in there. like I said earlier, it's been a roller coaster. I don't know about all of you, but like I go through phases where I need to read all the news and then phases where like I don't want to know anything. Angie, you have your hand up?
Yeah, I just have a quick question, only
Sure.
because I've heard rumors out there and I don't know if you guys have heard it or not. But have you heard anything about New Hampshire Housing opening up their vouchers this month to start vouchering people again? Or is that just hearsay, basically, is what I'm guessing?
I haven't heard anything, but I like I said, I have a meeting there on Monday, so if I get any information, I can certainly share it. I know way back when the vouchers were kind of shut down, they had said they hoped it to be sometime in the spring, but I haven't heard that update.
And then my other question is I've seen this link that you had put into the chat prior to this meeting. So, you know, obviously we're all in the unknown currently with everything that's going on nationally and with the renewals and what have you. What is the implications should it come to this point where there is a shortfall and now we have almost 20,000 people who become homeless or more? What's that going to look like for the administration and
Yeah, I don't
and that
know.
stuff, you know? Yeah.
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 I don't know. I would say those are good questions and concerns perhaps to raise to your federal delegation.
And I will say that the groups that are out there that do advocacy around homelessness have those statistics of how many people this is going to impact. And so that information is out there for the public, whether we're level funded, underfunded, or what happens in the next couple of years and the impact it will have. I think that I always say it wrong, Melissa. It's the National Low Income Housing Coalition.
Mm-hmm.
Has some great information out there as well.
Yeah. And if you follow the National Alliance to End Homelessness, sorry, I was pausing for a second because I wanted to make sure I had the right one. Yes, they, if you sign up for their emails, they send out calls to action when things like this come up, and they'll draft a letter for you. And if your agency allows you to do those things, follow their rules. I know state employees, if you're on here, you are 100% allowed to do those things, not from your work email and not on work time. But feel free to send all the emails, make all the phone calls you want from your personal devices off work hours. And please conduct your work business on your work devices. That's all I've got. All right. Christy, anything else, or are we good to wrap it up? We're good to wrap it up. All right. Well, thank you, everyone. I hope you all have a great day. Bye.